Dawn Maria Langdon. My role is I'm an advanced nurse practitioner and also I'm a lead project cancer nurse, and I'm currently employed by the Thanet KIC, but I also work with Minster Surgery doing women's health clinics, predominantly in the menopause. Well, I've been nursing for 30 years. So I was one of the original Project 2000s. It was quite an interesting story. I worked for Marks and Spencer's, had a baby, and I wanted to do something and went for a job as a healthcare assistant at Buckland Hospital. And they said I was too overqualified because I had A-levels and to go off and do my nurse training. And I ended up back at Buckland as part of one of my placements with that sister that advised me to go off and do my training. So I did my 3 years pre-registration training and ended up working on the renal ward, East Ward it was then, at Kent Canterbury. But I knew I always wanted to come into the community, but I didn't know whether I wanted to be a midwife in the hospital, or but then come into the community, or district nursing, or health visitor. And in the end I chose district nursing, so I came out of the community. And then I went off to South Bank University to do my degree, and then I swore I'd never go back and do another, with bringing up children, do another degree or something, or further education. And 10 years later I went back and did my course at the university for advanced nurse practitioner. That was in 2007. I've been working at Minster Surgery. I was their district nurse and their nurse practitioner, and then when this role came up I decided to take early retirement last year. I was on the oversight group for this project and it was very exciting, and it was only for 12 months. So I took the project lead, which has been so exciting. Lots of engagement and collaboration with primary, secondary and tertiary sectors, and also doing my women's health and menopause clinic at Minster. I always knew, my mum was a nurse. I didn't set out to be a nurse because I worked for Marks and Spencer. I was a junior manager there. But the opportunity came up. I wanted some sort of career, and I just saw an ad in the paper for a healthcare assistant, so I fell into it purely by chance. And when I worked at the hospital, I had placements out in the community and always knew that I wanted to work in the community. And also for selfish reasons, it was family friendly, the hours, because it wasn't as flexible when I was younger as it is more so now. So that's the reason I went into to primary care. And I've loved it. I can honestly say I've loved my career and I've had a great time, and I can look back and I've done everything I wanted to do and more. So I lead the project for it's to do with early diagnosis. The targets for cancer is that cancers are diagnosed at stage 1 and 2. 75% of patients should by 2028. So the project I'm doing is promoting that and making sure that patients get an early diagnosis. So I'm working for 6 surgeries in its kmpcth. I've managed to get into 3. I'm only part-time, and I've got a colleague, a social prescriber who works with me, and an admin support, and I've got 2 project leaders. So we look at patients that are referred on a 2-week wait pathway, make sure they've got the correct, they've been referred, they've got their appointments, they've got the correct investigations. We look at their family history of cancer, we discuss what potential investigations they're going to have, and we also promote healthy lifestyle and refer for support with regards to healthy lifestyle to prehabilitation and any other, so weight management support for losing weight. So trying to prevent cancer by reducing risks. So making sure patients, advising them about, ceasing smoking, having a normal weight, eating healthily, promoting skin safety, sun safety by wearing sun protection factor, making sure alcohol's within normal limit. So try and promote healthy lifestyle, especially post-COVID. And also screening, making sure patients are up to date with their screening, bowel, breast, cervical, and linking in with Macmillan. Obviously we're employed by the Kent Medway Cancer Alliance, linking in with the voluntary sector like Social Enterprise Kent, to and the Cancer Cafe, was involved with the opening of a Cancer Cafe with Graham Sargent for peer support for patients that are diagnosed with cancer. And the other in Minster, I've gone back to Minster to do a women's health clinic, which has developed into a predominantly menopause clinic, So I've had quite a lot of extensive training in that area. It's been very eye-opening, especially with regards to lifestyle, supporting patients with their symptoms. I'm also a menopause champion as well, and that's very interesting work with the ladies then. Very, very satisfying. I think it benefits the patients because I'd like to think I've got good communication skills. I like to build up a nice rapport with the patients. I'm conscientious. I will go to the nth degree for a patient to give them the best possible care. I'd like patients to be treated how I would like to be treated. I've got a lot of experience. They call me a bit of a geek. I do lots of studies, updates. I just make sure I'm aware of all, everything that's up to date and what's new and innovative and what's going on. The practice I've supported is, I think, from a point of view that my experience, my clinical knowledge has helped. And supporting practice gets quite hard out there in primary care at the moment. I know they're, especially from menopause, especially is very, very high up in the on the agenda at the moment. And so those patients, so the practices are benefiting from me being there because I'm able to give that care to that cohort of patients that are needed. And from the other role that I've got, the practices are benefiting. So when I'm helping with like the cancer, from the patients, they're getting the benefit that so I'm doing the cancer care reviews with some patients and providing the support with those on the 2-week wait. But that also helps the GP surgeries by hitting their targets for QOF, which is giving high standard care and also impacting hopefully on their dashboard, the primary care dashboard, looking at figures to make sure they achieve higher standards of care. So Community Education Facilitator, I support the medical lead. We're called non-medical facilitators now. I'm involved in education for the nurses in care PCN, so for the 6 surgeries, and we set up the PLTs, so the trainings, the training sessions for the doctors and nurses, making sure that the nurses are accessing their CPD funds. I work closely. We have an administrator, so we work quite closely together and with the training hub to support the nurses to get their education so they can develop their careers to go on to in whatever they want to do within their, although it's mostly practice nurses. There's healthcare assistants, there's admin, because obviously I quite focus quite clinically, but there's admin as well that are a part of that greater melting pot and who are very important as well. We are involved also with a consultancy, Rebecca Giffney. She's supporting us to develop these roles because they were quite new, because it was all done through the training hub originally, and then obviously it's come out to the clinicians, and we support each other. So we have regular meetings to discuss what's needed based on a needs analysis, really, what's needed for the area educationally to support the staff, to support, patient care, and hopefully keeping the staff that we've got by supporting them, because obviously in Thanet there's quite an ageing workforce. So we've got to look after the staff we've got and promote it for the new staff that are coming on board. So I've helped with the new to practice course, so I've been involved in that as well, which has been very very successful. So it's kind of keeping the future workforce and the workforce that we've got in Thanet. Well, as regards to the cancer project, we didn't get the refunding. It was only a 12-month project, but I'm just waiting to hear. That was the bid we put in at the end. We knew it was only 12 months, but we did think that maybe as a service development, because it was a pilot project initially, we would get another bid based on service development, but we didn't. But we've got another bid at the moment. So today I'll find out whether we can go ahead with that, which is quite an innovative bid with regards to cancer services. I'm also going to carry on with my CEF role. I will carry on with my women's health and menopause role, and I think there's probably more scope for that with regards to Thanet itself, but that's in very early talks at the moment. And I think probably the world's my oyster, really. I could go back to being an advanced nurse practitioner. I don't particularly want to be employed anywhere. Maybe I can do some locum in, or I don't know. I've applied for a fellowship as a legacy mentor to try and give my skills and coach and mentor those, you know, staff that are there to develop their careers, and hand over my expertise to leave with those staff. Yeah, I really do enjoy the education side. I'm a practice assessor. I set up some clinical supervision with colleagues for the trainee nursing associates. I've just had another set with practice nurses the other week, so I'm kind of trying to drive that forward as well, but it's quite hard to do in the time that I've got. I only work 3 days, so trying to do the project, plus I do my extra women's health, plus do the CEF, plus do the clinical, you know, it's quite, you know, it takes up a lot of time, but it's very enjoyable. So yeah, that's what, and you know, and just my mentoring is, yeah, I really enjoy that, because as I said, I was a mentor of the year. I can't remember what year, and you know, I've had really good feedback from the students, and I think if I can you know, support those nurses, new and the ones that are there, make a difference. And like I said about the podcast, that was my biggest claim to fame. That was mentioned in a podcast by a student in her career. She's a practice nurse, and she said that out of all the mentors in her journey, that I was the one that made the difference, and I feel very privileged that she said that about me.